Mr. Chairman, ladies and gentlemen, thank you very much for the opportunity to speak now about the future of tricuspid valve interventions, now especially when we are using the EVOQUE valve system. These are my conflicts of interest. Now, before we go into the valve replacement, I would like to share with you the current data of the Pascal repair system in the tricuspid setting. We have now analyzed in a commercial use experience the data from Ulm, Leipzig, Siegburg, and Munich, to all here in our echocardiographic core laboratory. And as you see, more than 150 patients were collected with a severe risk, and all have been treated for severe TR. When we're looking at the echocardiographic data, you see that most patients had either severe, massive, or torrential TR in the beginning, which was significantly reduced to either mild or moderate at the end of the procedure, and 90% of patients had such a good TR reduction. And which I think is very promising is to see that also the durability of the TR reduction is maintained, with 83% having this mild or moderate TR at follow-up. This translates into a significant clinical improvement, as you can see here on the right side, with 2/3 of patients being in New York Heart Class 1 or 2. Now, with these promising results for transcatheter edge-to-edge repair, we have to acknowledge that some patients might not be optimal candidates for an edge-to-edge repair. And for those patients, a replacement system, as you see it in this movie, might be another good option to treat those severe tricuspid regurgitations. This is the EVOQUE valve system, which uses a catheter delivery system where you can easily access the right ventricle and place the tricuspid valve, here the EVOQUE valve, into the tricuspid annulus. There are already some data available for this device, and I would like to share with you first our Munich experience in a compassionate use experience. The first 4 patients with very severe TR, some with pacemaker leads, as you see on the right. And when you place these valves, you see also here already in follow-up a very, very good TR reduction, almost zero or trivial TR at follow-up. These data were also being gained in the TRISCEND study, a study in the US, which included here 56 patients, very old patients with a significant risk, as you can see. And of note, more than almost 80% had a pulmonary hypertension with a pulmonary arterial pressure above 30, despite having severe or torrential TR. And the other important thing is that about 1/3 of those patients had a lead across the tricuspid valve. I think it's remarkable that almost 100%, in fact 98%, had a successful procedure with the device success, and the procedural success was 94%. When we're looking at the data now, these data in terms of TR reduction looks even more promising compared to the edge-to-edge repair, with almost 100% having either non or mild TR. And you see this great result also in this video playing here on the right side. Now, when we're looking at the symptomatic improvement, this was also remarkable. 80% almost had a New York Heart Class 2 or 1 at follow-up at 30 days. A significant improvement in the physical capacity and in the quality of life. And with these promising data, I would like now to conclude the following, that we have seen a very, very promising edge-to-edge repair system with the Pascal system, and the ongoing analysis of our commercial experience shows very good procedural and follow-up patient outcomes for those patients. For the patients where this device might not be the best, we have the EVOQUE valve replacement system, and the early experience with this EVOQUE valve system demonstrated technical feasibility, safety, which I think is very, very important, and a great TR reduction, even a TR abolition in many patients. And this translates into very significant symptomatic improvement at 30-day outcomes. Thank you very much for your attention.